muchas gracias. Gracias por la invitación y estoy muy contenta de estar aquí con ustedes presentando mi investigación y mi trabajo. Eh, voy a, Me da mucha pena, pero voy a hacer la presentación en inglés y espero que en un futuro próximo puedas hacerla en español. Ahorita voy a compartir mis
Por-
slides. Ajá.
no se olviden de utilizar el lenguaje de interpretación para aquellos que no sean bilingües.
Ok. ¿Tengo que cambiar el display?
Perfecto, está perfecto.
Ok, muy bien. Ahora voy a mover acá arriba para poder ver. Bueno, thank you for having me. It's my first time doing a live interpretation presentation, so please remind me if I need to slow down or spell out an acronym. So I'm going to present on extreme heat and farm worker health in North Carolina. To start, I like to give a little bit of a background about me and what motivated me to pursue my research focus on climate and health, particularly in marginalized communities, in this case, the farm worker community. So I'm a migrant. I came to this country when I was 4 years old, so I have a little bit of that first generation struggle that a lot of first generation children experience. I'm a daughter of outdoor worker. My father was a construction worker for many years, and that became his primary job when we migrated to the United States. For the last 10 years, I've been working in public health, doing work in HIV, global health education, vaccine communications, culture humility, anti-colonial research practices. And lately, I've been focusing on climate and health, in particular the farm worker community. I am from California, so I was exposed to a lot of wildfires. And during the pandemic, when the farm worker community was declared as essential workers, I questioned our collective approach to this community that feeds us, yet lacks so many protections. So I decided to go back to school and pursue a doctoral degree so I could have more freedom in designing my own research and answering questions that impact my community. I'm currently, as Viviana said, I'm currently in my second year in the Department of Population Health Sciences here at Duke, and very happy to be a part of the Latin 19 community. I also have a daughter who's 3 years old, and she's the love of my life. I am very proud of my Mexican heritage and very attached to my abuela Vicky, whom I named my daughter after. And I wrote a children's book as a way to honor my grandma, my culture, my hometown. And the book is called La Casa de Vicky. All right, so now let's talk about climate change and how it affects our health in direct and indirect ways. The direct effects include heat-related illness, respiratory disease, heart disease, food, water, and vector-borne diseases, injury, premature death, mental health impacts, poor maternal birth outcomes. And indirectly, we're impacted by chemical releases into the environment, changes in air, water, food quality and quantity, population displacement, interruptions to healthcare, infrastructure and supply chain disruption, and economic impacts, more people living in poverty. A truth that we might be aware of is that climate change affects us all unequally. These groups are usually affected the most. They are underserved populations with health disparities, which include some communities of color, low-income populations, low educational attainment groups, immigrant groups, and indigenous groups. Exposed workers like farm workers, construction workers, and landscape workers, persons with disabilities. There is an increased vulnerability by life stages. They are prenatal, infants, young children, pregnant women, the elderly. There's also similarly, there's an increased vulnerability associated to chronic medical conditions, They are like diabetes, asthma, cardiovascular disease, and also populations in low middle income countries, they experience higher rates of existing disease, malnutrition, and extreme poverty. A lot of the rising temperatures that we're experiencing are due to climate change. Every year for the last 10 years, we've hit a record temperature and it's expected to continue to get hotter. As we experience hotter days, nights are also getting hotter. Outdoor workers are at increased risk of poor health outcomes. Farm workers in particular are a vulnerable group. They still lack heat worker protections at a federal level and in 45 states. Currently, only California, Colorado, Minnesota, Oregon, and Washington have some form of heat illness prevention regulations. Maryland is in the process of drafting some. There has been a lot of push from advocacy groups, and it is starting to reach the federal level. Last year, the Secretary of the Department of Health and Human Services, Secretary Becerra, launched an initiative on protecting farm workers from extreme heat and wildfire smoke. A big deal too is that OSHA, the Occupational Safety and Health Administration, under the Biden administration, began to draft the document on heat workplace standards titled Heat Injury and Illness Prevention in Outdoor and Indoor Work Settings. This is a proposed rule. It's currently open for public comments up until December 30 this year, which means all of you can go to the website and submit a positive comment in favor of this standard. As a scientist, I believe that we have also the power to advocate. And so this is a little bit of what I'm trying to do with this talk. Also, with election year, I think voting is very important and how these policies can get dropped depending on the administration that is elected. So with continued poor working conditions, higher incidence of heat-related illnesses will be on the rise. And I apologize if let me know if I'm going too fast for the interpretation. I am trying to manage the chat box in my notes and the slides. So let me know if I don't.
Elizabeth, don't worry about the chat. We'll take care of it afterwards.
Okay, thank you, Viviana. So let me know if I need to slow down.
Slow down.
Heat-related illnesses range from heat rash, heat syncope, heat cramps, heat exhaustion, heat stroke, and death. There's also evidence in some parts of the world of chronic diseases such as acute kidney disease and chronic kidney disease that continue to be researched and are due to continued heat exposure in the farm worker community. During the period of 1999 and 2003, this is the latest record that I was able to find. There were 3,442 deaths attributable to heat-related illnesses in the US. And this figure is most likely underestimated since the criteria to determine heat-related deaths vary by state. And heat exposure may not be recorded as a primary cause of death. So additionally, farm workers' risk of heat-related illnesses is 20 times greater than all civilian workers. Existing literature highlights the challenges that farm workers across the US face. These include barriers to healthcare, lack of adequate insurance, cultural and language differences, and insufficient housing and food. Additionally, migrant and undocumented farm workers have added factors that severely impact their health and the power to address them. An example you may have heard of is last year, Jose Arturo Gonzalez Mendoza, a 29-year-old migrant farm worker from Mexico, who was working on a sweet potato farm, died from cardiac arrest only 11 days after arriving from Mexico. The temperatures that day were in the 90s, and the only shade available to them was a bus with no AC parked in the middle of the fields. He was an H-2A visa holder, which means he was legally working in the fields as a seasonal worker. The report from North Carolina Department of Labor says that management never called the healthcare services or performed first aid treatment, despite him reporting that he wasn't feeling well. Another farm worker had to call the emergency services, but unfortunately, Jose Arturo died before they arrived. The farm was fined for hazardous conditions. This is an example of terrible working conditions that are somehow missed at the federal labor laws, which don't extend to agricultural jobs. And it's still uncertain if those hazardous conditions have changed for that particular farm. In North Carolina, they have developed the NC Heat Health Alert System, which anyone can register to receive alerts for when your region, you enter your zip code, and then they assigned one of these regions to you. So when your region exceeds the threshold for heat, they'll send you an alert. And this is a tool that was launched in May this year and is expected to be helpful overall if people do register to receive these alerts. It can be helpful for youth sports, outdoor activities, and it can be used for farms by farm workers to modify some items that they do have agency to modify, like proper clothing or carrying more water with them. However, we know that the reality of growers and employers using these tools and implementing changes is complicated. It requires a systemic change to receive the dignity and safety as a farm worker. This starts with basic human rights, economic justice, which includes fair wages, safe housing conditions, access to healthy foods, etc. Part of the systemic problem are also the legal gaps in worker protections that I mentioned previously. And then lastly, this list is a list of items of proposed standards for worker protections against heat. They are water, shade, rest, heat acclimatization plan, exposure monitoring, and there is a difference between these two systems of how we measure temperature, wet bulb globe temperature versus the heat index. A heat alert program similar to the one that North Carolina has developed, training and education, surveillance and record keeping, and whistleblower protections, which is a big piece of this puzzle to protect the workers that do call out hazardous working conditions. And so if I may, I'd like to quickly go back to this OSHA document and how important it is to comment. I've created this QR code. If you would like to go in and post a message in support of this, I'm collecting emails, and the form will take you to a Google form. The emails that you send to your email, it's coming to me, and I will collect the emails and send a template that I encourage you to copy and paste, but then you have to edit it to personalize it. Maybe you've seen it in other, when trying to pass other laws, encouraging public support. And so they give you these templates, but the key is to modify it and personalize it so that it can count. If 1,000 people send the same template, it only counts as one. So if 1,000 people get that template, but everybody modifies it, then it counts as 1,000. And so now that I've given a big sort of macro view of the problem and systemic oppression of farm workers, I'm going to bring you back to my research study, which I hope will impact policies and improve the quality of life of farm workers. As you may imagine, there is a significant research gap in this population. The farm worker population can be defined as a hard-to-reach population, mostly due to toxic environments of working environments and toxic living conditions, immigration status, and fear of job loss, amongst others. There is limited research on heat-related illness and climate change's long-term impact on health. I mentioned acute kidney disease and chronic kidney disease, which is still being researched, though most of the studies are done abroad. and scientists are now starting to focus on domestic work for this disease. There are, however, some studies and efforts focused on education tools to increase heat awareness and ways to decrease heat risk focused on proper hydration, clothing, rest, etc. There is limited scientific knowledge around interventions co-designed by end users, in this case, the farm workers, implementers, the growers, and public health researchers, which leads me to my research question. What interventions exist to address the increased risk of heat-related illnesses in the farm worker community? And what interventions does the farm worker community want? There is this quote from a climate scientist related to this topic, and it reads, there should be clear standards for water, shade, and rest. There is a difference between drinking cold water and drinking water that's turned hot from the sun, between a true 15-minute rest break and doing light work while on a break, between resting in the shade of a truck and resting in the shade of a tent with air conditioning. So to help me answer these questions, I'm collaborating with the Duke Heat Policy Innovation Hub that's within the Duke Nicholas Institute for Energy, Environment, and Sustainability here at Duke, the North Carolina Department of Health and Human Services, and also with the North Carolina Farm Worker Health Program, a program of the Office of Rural Health. So to answer those questions, I have divided my research into 3 aims. The first one is through a systematic review. I aim to identify existing interventions in the US that have been put in place to reduce the risk of heat-related illnesses in the farm worker community. So I want to find out what's already been done. Aim 2 is to explore the underreporting of heat-related illnesses by farm workers, looking at data from civilian hospitals and records of patients reporting to the emergency department with heat-related illnesses. This analysis will focus on detecting farm worker occupations through intake notes or triage notes, and enabling better characterization of the potential underreporting of HRIs in the farm worker community. Lastly, our goal is for aim 3 is to co-develop an intervention with farm workers and growers, meeting with both groups separately and discussing potential interventions with the end goal of designing one that we could pilot during the following heat season. And heat season runs mostly from May to August or September, but it varies like depending on what the state declares it, the heat season. In other words, so here, aim 1 will be looking at the background, aim 2 will be looking at North Carolina specific data, and then aim 3 will be the intervention design. This is a visual representation of my research, or the conceptual model. Aim 1 will be to identify modifiable factors in literature. Aim 2 will be to characterize farm worker heat-related illnesses per emergency department visits by North Carolina zone. And these first 2 aims will help inform my 3rd aim, although aim 3 is not dependent on the results of the first 2 aim. Ideally for aim 3, I will work with 4 farms in North Carolina and create 2 community advisory boards that will be the co-design groups. One cab will consist of growers and the other cab will consist of only farm workers. The goal of the cab is to help shape the intervention, provide guidance, and offer advice for future studies. During the phase 1, we will be setting priorities for the cab and identifying potential modifiable factors that could become a part of the intervention. For phase 2, we will include in-depth interviews from farm workers and growers. These could be the same as a cab members, but it depends on recruiting efforts. During these interviews, I want to assess awareness and risk perception, plus identify modifiable factors. And then for phase 3, we'll be meeting again with our CAB, where we present the findings of the in-depth interviews and identify design themes, and then have the final design approved by the CAB. The eligibility criteria for participants are all English or Spanish-speaking adult farm workers in North Carolina who work in the farms during the summer months. We aim to enroll a diverse study population in terms of race, ethnicity, and gender. Recruitment for the CAB members and in-depth interview participants will be done with the help of our collaborator, the North Carolina Farm Worker Health Program, through targeted recruitment efforts. There will be an in-person informational session to inform the community about the study and to help answer any questions from potential participants. And then, so one of the primary goals for this study is to collect enough data to be able to pilot the study, pilot the intervention. The impact that we hope to achieve is to inform effective preventative measures against heat-related illnesses, to encourage the adoption of intervention by farms and growers, to provide more information to farms about interventions like these. And once more data is collected, we could do a cost effectiveness analysis to motivate them to implement these changes. And so this need for data highlights the need for more research on this population. Also to inform policy to expand worker protections to the agricultural sector. And lastly, and most importantly, is to improve the overall health and quality of life of the farm workers. So I know I've covered a lot, maybe a bit too fast too, but I want to thank you so much for your time. And if you have any questions, thoughts, or comments, I'm open to hear what you think about this, or any stories to share. You can feel free to, we can discuss it now, or you can email me separately. That's my email, or if you want to connect through LinkedIn, I have another QR code.